Good. The Center of Evidence-Based Medicine, CEBM, suggests this structure in critical appraisal. First, we should have a focused question. Does the article have a focused question? Yes, if yes, then we go on with the appraisal. And during the appraisal, we appraise whether the results, the study methods are valid. So whether the article is valid, has valid methodology. Then are the results important? So if it is valid, are these valid analysis important? And lastly, are these valid and important results applicable to our own patients, populations, or setting? Here is our example. A 60-year-old female presents with right low back and leg pain for 6 months, much worse in the last 2 weeks. She wants pain relief. On the physical examination, there is very mild weakness in the right extensor hallucis longus. So, you know probably which muscle that is, but I brought you a picture for that. The first impression, of course, is right L5 lumbar radiculopathy, disc herniation. The question follows is, in a PICO format, of course, in patients with lumbar radiculopathy, this is our P problem, patients or population, the intervention and comparison groups, lumbar disc surgery, this is one alternative, one option in this kind of patients' problems. Then compared with non-operative care, so physiotherapy or lifestyle modifications. This is our I and C, and the outcome would be result in improved pain relief. So you could have some other outcome, such as change in the computer tomography findings or daily activities, performance of daily activities, but I prefer to choose pain relief. When I search, I will not conduct a search with you, but I did this search and I come up with a relevant, apparently relevant article, which is answering actually my research question, my interest. Surgical, by Weinstein et al., surgical versus non-operative treatment for lumbar disc herniation. So the SPORT, a randomized trial, a SPORT trial. Surgical versus non-operative. This is on many occasions a clinically relevant issue in our daily practice as general practitioners or as family physicians. Let me make a break here. Then I will continue on discussing this article with you.